Hello everyone. Today we will discuss about the ligaments present in the knee joint. Especially we are focusing on two ligaments. One is medial collateral ligament, another one is a lateral collateral ligament. Okay. So medial, we all know that like medial collateral ligament have two branches. One is a superficial branch, another one is a deep branch. So deep branch is attached to the, not a branch, it's also known as layer. So deep layer is attached with the meniscus through a meniscofemoral ligament. Meniscofemoral ligament. Okay.
Now MCL attachments. MCL starts from the medial epicondyle. This is the femur. We have a lateral epicondyle and medial epicondyle. It originates from the medial epicondyle and inserted in the pes anserinus of the. It's one of the part of tibia where the MCL gets inserted. Okay, we all know that MCL we have a superficial branch and deep branch. So while now we'll talk about the valgus stress. See, the valgus stress is depends upon the degree of the flexion and extension. The strains or depends upon the degree of flexion and extension. So 57% of the restraint happens in the extension position. Balance 78% of the restraint happens at flexion position. Why the restraint percentage is less than in extension position? Because of the closed back. Because of closed back. I have understood with the model. Okay. So this is, imagine this is the model, this is the femur, and this is the tibia. Okay, now imagine that. See, what is closed back position? When both the ligaments getting taut and congruency is more, what will happen? So if anyone kicks from in extension position, fully extension position, if anyone kicks from the outside like that, it will be happen. While the time MCL will also work apart from it, while in closed back position, ACLs, other capsules will work on to stabilize the knee joint. So in that time, MCL load will be less than, so that the restraint will be less. While in, but not like that. When in flexion position, the restraint is more higher than extension due to open back. The only reason at extension the restraint is less due to closed back. And also it happens anterior translation will be happen and lateral rotation will be happen. This is MCL. We'll talk about the LCL. LCL attachments. What are all the LCL attachment? Same like that. It originates from the lateral epicondyle of the femur and inserted into the fibular head. Okay, not tibia, fibular head, along with the biceps femoris. LCL is the extra capsular ligament, right? So here also we have a primary restraint and secondary restraint. In primary restraint, the varus force will happen at 5 degree of flexion, 55% will happen. At 25 degree of flexion, 69% of the restraint will be happen. At secondary restraint as a lateral rotation, as we seen in the same as MCL. I would like to add another thing in it. So last class we talk about the patellar plica syndrome or else patellar positioning or all, right? So that, see, we all know that this is fibula, this is tibia, and this is the femur. This is the lateral view. This is the patella. Okay, this is the IT band where it's all coming from gluteus medius and TFL. Okay, and gets inserted in the Girdis tubercle. It gets inserted in the Girdis tubercle of the tibia. It's one of the part where the IT band gets inserted. Also, this IT band connects with the patella through the lateral patellofemoral ligament. See, this IT band connects with the patella through a lateral patellofemoral ligament. See, if the IT band gets tightened, what will happen? The position of the patella will shift. See, this is knee. This is patella. Okay. If IT band gets tight, this patella will shift laterally. This is known as patellar plica syndrome. I hope you all understood. See, let's summarize what we all discussed in the class. We saw about a MCL superficial layer and deep layer, and the LCL, and the restraint, how will happens, how the restraint will less than in full extension due to closed back. I hope you all understood. Stay tuned for next video. I hope you all doing good. Let's see. Do follow the PT classroom. Thank you.